morning, dosto. My name is Kamal Yadav. Today we'll discuss about the medical billings and their concepts. So let's start this video and discuss about the what is the medical billings. As we have seen in a multiple video that is related to medical coding, but in this video I will discuss the complete guide or guidelines for the medical billings and manual concept, so you will be able to understood what is the medical billings and how it is working, how it is working into the medical healthcare industry. So let's start this video. If you are new in my channel, please like subscribe this channels. Medical billing manual concept. So weak contents are there: glossary of the billing and insurance terms, daily use abbreviations, place of service POS, evaluation and management ENM code range, diagnosis code ICD-10 or 9 series, laws, modifier, introduction of government insurance, global periods, 837 files and 835 files, labels of appeal for the Medicare, other terms, label of appeal or Medicare's, other terms, claims adjustment reason codes, revenue cycle management RCM. So we will understand what is the RCM, how is it working. So you will be able to understood glossary of billings and insurance terms. So account numbers. The first point is coming account number. The number assigned by your provider, hospitals, physicians, home care services. These are examples when the medical service were provided. So account number is the one number that is provided by the provider to the patient. Examples are there for the hospital, physician, home care services. So this kind of services they will provide. Adjustment. The person of the your bill that your provider has agreed to write off. So like this is the amount or like a dollar amount which provider agree to write off. It means that provider will be give discount. They will not take money. So that is comes under the adjustment. Admission date. What is the admission date question is coming. So the date of admit for the treatment. Any patient who is admitted to hospital or stay in a hospital, the first day on which date a patient was admit, that is called admit date. Admit diagnosis. So admit diagnosis, words, phrases your doctor used to describe your condition. So when the patient come to the hospital or like on any facility, then patient having some problem. So that problem reason for the admit or like inside to the hospital for treatment, that is called as admit physician. Means that condition which was present or which is present during the admission of the patient. Advance beneficiary notice, ABN, a notice stand government form CMS R131. So like it is the standard form is a CMS R131. Your provider gives you before you are treated, informing you that Medicare will not pay for the treatment or service. So this is a kind of one notice which provider is giving to the patient, like any services that is not covered by the Medicare insurance. The notice is given to you or patient so that patient may decide whether to have treatment and how to pay for it. So advance beneficiary notice is that term and condition which provider given to the patient, like this service, this like a procedure operation is not covered into the insurance or Medicare will not pay. So it is your responsibility. If insurance will not pay, then patient will pay the services. So that is like a kind of notice that is given, and in a technical term we are calling as advance beneficiary notice, ABN. CMS forms, CMS R131 is also called. Allowed amount. What is the allowed amount? That is showing into the billing chart sheet. The insurance company maximum amount allowed for each procedure code is called allowed amount. So for example, one CPT is showing the $200. So $200 is the allowed amount that CPT should be billed for that. So that is called allowed amount. Ambulatory surgery, outpatient surgery or surgery that does not require to overnight hospital stay or 24-hour hospital stay, that is called as a ambulatory surgery or same day surgery. These kind of terms are used. Amount not covered, the term is coming when you are checking the forms. Amount not covered, what your insurance company does not pay, including deductibles, co-insurance, or charges for non-covered services. So, for example, insurance company does not pay deductible, co-insurance, charges, or any amount that is considered as the no amount not covered. Appeal is like kind of things we'll discuss, a process by which you, your doctor or your hospital can object to your health plan when you disagree with the health plan or decision to deny the payment for your care. So it means that appeal is that kind of things. One patient is taking services, provider is given services, but insurance company is denying to pay that services. That time provider is giving a full proof support, this patient required this treatment or medical necessity is required, that's why physician given this service, you should have pay for this service. So that format is called the appeal. In this scenario, appeal 1 2 3, this kind of like process are there. So that way the physician or like we are filing the appeal 1, appeal 2, appeal 3 along with the medical documents or requirement format, we are like adding and sending to the AR. So appeal are generally electronic appeals or paper appeals are we are sending. So this is the we'll discuss into the another points. Assignment of benefit. So assignment of benefit term is used. So an agreement you assign that allow your insurance to the pay the provider directly. So for example, one agreement is done by the you patient to that company, this amount directly pay to the provider. Any services, any like treatment is given to the provider or patient, that amount will be agreed already. So that is called an agreement you assign that allow your insurance to pay the provider directly. Attending physician, the term is used, the doctor who order your treatment and responsible for your care. Means that for example, attending physician is that physician who is giving the treatment to the patient, who is taking care of the patient, who giving the injection, medicines, drugs, anything, order lab. So that person is responsible for the treatment of the giving the treatment of care. Authorization number, what is the authorization number? A number stating that your treatment has been approved by your insurance pay plan, also called a certificate number, prior authorization number, statement authorization, or service. So authorization is the kind of things, for example, if one patient is coming for the knee surgery or physician is given to the information to the insurance, this knee surgery is covered into this patient insurance or not. If insurance is saying yes, this is the like procedure is covered under the plan, so that time the physician perform the surgery and sending the claim to the insurance company, then insurance company is accepting and approved. So that format is called authorization. So type of authorization is a prior authorization, post authorization, and intra authorization. So three kind of authorization number, different name is calling, like certificate number, prior authorization number, treatment authorization number. So this is all details about you need to focus while doing the billing things, billing, charge billing or payment posting, this kind of thing. Champs VA is the insurance linked to the military services. So whenever champ VA is mentioned, it means that insurance linked with the military services. Claim number, as I told, that claim number, a number assigned by the your insurance company to an individual number. So claim number is generally created at the date of service on that day patient and provider given the service treatment and to the patient, that is called that date of service. So one date of service having one claim number, so claim number is assigned for the visit. First this visit one claim numbers, and how many on that day how many services are performed, that time we created a single claim number. Sometimes some company have a, some insurance have a guideline, so we are creating multiple claims for the multiple CPT code. So this depends upon the like requirement, but generally claim number is a single in which the multiple CPT we are like appending or adding and sending to the insurance company. Center for Medicare or Medicare Medicaid Services CMS, Center for Medicare and Medicaid Services CMS. So the federal agency that runs the medical Medicare program. In additional, CMS works with the state to the run the Medicaid program. So this is the kind of a government body which is a agency that run the Medicare program, or CMS works for the state to run the Medicaid program. So for example, center it is running the Medicare, for the state wise it is running the Medicaid programs. Coding of claims. Coding of claims is a translating clinical information from the your medical record into the numbers such as diagnosis procedure code that insurance companies use to pay the claim. So coding is, what is the definition of coding they are explaining here? Translating the clinical information like a medical record, medical document is a transfer to the numbers such as diagnosis and procedure, that is called as the codes or coding that insurance company use to pay that service. Okay, so you will be able to see here, give me a moment. So we'll discuss about the co-insurance. So co-insurance is a person or fixed percentage of the allowed amount insured, like who is taken the insurance, a subscriber patient has to pay to the healthcare provider. So it is a kind of service when the any services is taking, that time patient will give some amount. For example, for that service $100 is required, that time patient need to pay the co-pay is 20, as per agreement $20. That time each and every visit patient will be give the like a $20 to the provider, then the service will start. 80 $80 will be paying by the insurance company. That amount is called as a co-insurance or like that. What is a worker compensation? Second question is a coming worker compensation. So worker compensation or worker comps is a form of insurance providing the medical benefits to the employee or injured or ill or injured person or injured patient or ill patient due to employment or when they are on the job. So like worker compensation is an insurance that is applicable when any patient is doing the work, during the injury happen, illness happen, problem happen, that time and worker compensation or worker comp insurance will be applicable. So this is a kind of insurance which are applicable when patient is working and injury, illness or problem is coming, that time they are using this insurance. What is the timely filing limit, TLF? What is the timely filing limit, TLF? Timely filing limit is a fixed time period to set each insurance company within which provider have to submit the claim after rendering the services. If the claim gets submitted after the time period, you may face initial denials. You may face the denial CO 29, which state that the time limit filing has expired. So what is that? For example, generally Medicare has a TLF is a 12 month. Some private or commercial insurance having a like a 6 month or 90 days. So it depends upon the insurance. Timely filing limited is like for example, after the giving the service, today is the date of service, today patient taken a service, after that 90 days, 6 month and 12 month time is there. So that time period is only allowed to send the claims, and claim will be reimbursed between these days. If that day will be increase after time limit, so insurance company is not responsible for that amount, and a physician will not get paid for that service if time limit filing is crossed. So we need to clear, we need to file the claims within a time limit file. If sometimes some correction, some denial, some so many reasons, that's why the claim was not filed timely, so we need to take care of whenever we have any things, timely limit or time limit TLF should be met. So these are about the time limit files. So next point we are checking here, for the worker compensation is there no TLF, so there is a notes if the worker compensation, so no TLF is there, time limit file is not required, the case can be responded at the any times, because sometimes what happen, patient is ill, he is not able to provide the document, so time limit may be increased. That's why HMO plan had just 90 days time limit, time file, TLF's limits. So if plan is HMO, so that time time limit, timely file limit is only 90 days. Medicare has a 65 days of the TLF, as I told that. BCBS, in BCBS, member ID stating that XOF or PPO plans having the TLF 365 days, member ID stating XOG MCO plan having the TLF is 180 days. Member ID stating XOH or HMO plan having the TLF is 90 days. XOU or MCR Medicare plans having the time limit is 180 days. So these are examples of the BCBS which insurance or type of insurance having the TLF days, time of days are given here. So you should understood it will be different for the United Healthcare, Texas, or Aetna, or like so many insurance are there. So it depends upon the insurance. What is a medical necessity? The term is coming. Medical necessity means, or does the patient require this treatment or not? We can face the denial CO50. Denial reason is coming CO50, which states these are non-covered services because this is non-deems or medical necessity by the payer. In this case, we can appeal or complete medical records which describe the patient illness support for this service. So medical necessity is what? For example, I will give that one patient is coming for the like a fracture and fracture on the right hand, and physician given the treatment of the fracture. So it means that that condition is a support to treatment of the fracture care. So here medical necessity it meet, but some things like that, some here you will see that cosmetic procedure, lip arrangement, lips arrangement, and that is not required. Patient is healthy, he is not ill and no need to any surgery, but that cosmetic purpose or physical appearance purpose, that surgery is performed, that time that is not met the medical necessity. It means that treatment is not required, however physician patient is taken services, that is called as a not met medical necessity. If any problem, any condition that required and physician given the services, that time medical necessity it met. So this kind of, whenever we are saying that this for example, one patient having the appendix inflammation in the appendix, and physician given the services procedure for appendectomy, remove the appendix, that time it is made the a medical necessity. So we need to check the compatibility, the diagnosis with a CPT code. So that is comes under the medical necessity. A lot of denials we are facing to the CO50 in medical coding. So whenever you are there seeing, you can check the competence. We have on a CMS site, we have a list which procedure, which operation having which diagnosis and compatible with diagnosis. So we are checking and we giving the article number. This article number is saying that this diagnosis is compatible for this procedure. Another example I will give you, colonoscopic procedure is performed. So if peptic ulcer or any ulcerative colitis is there, that condition will be compatible for the colonoscopic procedure. But there is some other condition, fevers, fever and a colonoscopic procedure is performed, that is not compatible, because here medical necessity is not met. For the fever purpose, that colonoscopy is not performed, so that should be matching with a procedure and a diagnosis. Difference between the CMS of 1500 forms and UV04 forms. So CMS 1500 form is used only the physician and professional coding or billings, and it is not for the hospital. Whereas UV04 or CMS 1450 forms is used by the hospital's billing or inpatient billing with the 81 fields located to enter all the required detail like HIPIX codes, NPI or tax ID, etc. So this is the difference between the CMS 1500 or UV04. So in a simple, CMS 1500 used for the professional coding, physician coding. UV04 or CMS 1415, it is called for the inpatient or admit patient or facility or hospital coding billing. So these kind of things are, we should be understood what is the difference between that. CMS 1500 form, we are giving here visualization, so you can understood what is the CMS 1500 form. The standard paper from the used healthcare professional and the supplies and bill insurance company. Here the sample of the CMS form, insurance form, you will see here insurance detail, all details are there. You will be check here the CT, patient information, zip codes, all details are there. Here you will be 14 numbers, name, physician, all details here. 1 2 CPT is given, CPT column is here. You will see hip CPT modifier, pointers, diagnosis, changes. These are NPI, tax ID, all detail information are updating here. So this is called the form ID, or all details will be this form sending to the claim insurance company into the form of claims. Medical billing manual concept, you will see here the UV04 claim forms, a standard form the used by the institutional providers like hospital to bill insurance companies for the medical. Some samples are there, so you will check here any hospital 1 2 3 state, any details, hospital address, inpatient purpose, that was outpatient. And then you will be add here the some like provider details, CPT code, ICD code, all information you should be add here. And then this form will be going to the claim company, and that is example. So now next term is coming co-payment or co-pay. It's a fixed amount payable to the provider by the insurance for each visit. So I was told that like a co-payment, co-insurance is like a secondary insurance, or co-payment is that one amount is a fixed whenever patient visits to the doctors, that amount should be payable. So it is a fixed amount payable for to the provider by the insured mean that, and who is taken insurance or subscriber for the each visit. Coordination of the benefit. Coordination of a benefit is how insurance company work together when you have a more than one insurance plan. So multiple insurance is there. So that time coordination of benefits is there. That company work together. The patient may be covered by the more than one commercial insurance plan, such as through a employee as well as a spouse, patient, or domestic partners employees. If you have a more than one insurance plan, check with the secondary policy to find out how it cover expenses left over your primary coverage has paid its part. So for example, one patient have a three insurance, primary, secondary, tertiary. That time primary insurance will be paying some amount, remaining amount is left, that amount will be going to move to the secondary insurance is the paying few amounts. After that, if some amount is a remain, so tertiary insurance will be paying for that. So in that time, coordination of benefit form is there. So we need to check the all guideline how it will be applicable. So that is called coordination of benefit. Covered benefit, what is the covered benefit? Service that your insurance company pay for the pay in a full part or part in. So it's here like a, for example, insurance company given the list, this problem, this operation, a list of operation they are paying. Sometimes they pay the full amount, sometimes they pay the partial amount. So we need to aware of that, which condition is a full paid by covered under this insurance, which insurance is a partial paid. So that will be coming under cover benefit. Cover days, so the days your insurance company pay for in full or part. So cover days is also given into the given into the policy, how many days under this file or claim will be generated, so company will be pay full pay or part pay. CPT, current procedure terminology, so their term is calling a CPC. CPT, current procedure terminology. Current procedure terminology, CPT is a code set that used to report the medical procedure and services to the entries such as a physician, healthcare insurance company, and organization. Example is a 11720 built for the debridement of the nail. So for example, CPT is generally operation codes. For example, knee surgery is done, or like sometimes colonoscopy done, sometimes the other procedure is performed. So any operations, any procedure that is debridement, incision and drainage, appendectomy, colonoscopy, these are a procedure for you. Physician perform the operation or procedure. For that purpose CPT are used, and each CPT has some dollar amount, so that dollar amount sending to the insurance company, and insurance company is paying for that service, so that is called as a CPT. Example here, 1170 for the debridement of nail. This procedure performed, that time we are appending the 1170 CPT code. There are three category of the CPT. Category 1 you will be able to see that, category 2, category 3. So category 1 covered the vaccine. So if category 1 is covered the vaccine, category 2 deals with the performance of the measurement, and category 3 is covered the imaging technology, services and procedure. The current version of the CPT 2010 or so it is, the services are CPT will be updated each and every year. So this is a given the one example, so you can check here. Category 1 codes are included here. Excuse me. Here a quick look at the section of the categories 1 CPT codes as agreement by they are the numericals. ENM evaluation management or visit stating at the 99202 to 99499. Anesthesiologist stating the 0010 to 0199 or 99102 to 99140. Surgery stating with the 10021269990. So these are a code range of the procedure like that. For the ENM purpose, we have a CPT code. Anesthesia, surgery, radiology include the nuclear medicine or diagnostic ultrasound, X-rays, or CT MRI stating 70010 to 7999. Pathology, blood test, urine test stating is the 8 series 00482 89356. Medicine exceptions, the anesthesiologist, EKG or ECG, EMG stating with the 902 81299199 or 9950299602. These are a code range of the CPT. No need to remember, but you should have an idea which kind of codes are mainly used. Category 2. Category 2, these codes are the 5 character along with the alphabetic codes that provided additional information to the category 1 codes. These codes are the format to the have 4 digit followed by the character F. These codes are optional but can provided important information that can be used to perform the management and future patient care. Here the quick example, if the doctor records the patient body mass index BMI during the routine checkup, we could use the category 2 codes 3008F. Body mass index documented, it is kind of measurement code, MIPS code. We are saying that HEDIS code also we are calling. These codes never replace category 1 or category 3 codes, and instead of the simply provided extra information. These codes are combined is a number of procedure typically occurs in the conjunction with a one or main procedure. Example is here 0001F, heart failure assessment including the all of the flowings, blood pressure management, level of activity assessment, assessed, and clinical symptoms of the volumes overload assess, weight records, clinical sign of the volume overloaded assist. So these all detail is covered under the 001F. So in this way this code are providing the extra information. Category third is the CPT code. The category third CPT Codes is made of the temporary codes that represent the emergent or the experimental services, technology, and procedure. In certain cases, you may find that the newer procedure does not have a category 1 code. These are codes in a category 1 for the unlisted procedure, but if the procedure, technology, or services listed in the category third, you are requiring to use category third code. Like the category second, these codes are a 5 characters along with the compromised for the 4 digit and a terminal letters. In this case, the last letter of the category third is a T. For example, of the code finalized of the sclera of the glycoma through the ciliary body is a 0123T. So these are the codes. Next, we are giving the next video, part 2 of the billing and denials detail. So I will explain in the Hapix code. Thank you for watching my video. If you are liking this video, please like and subscribe. My name is Kamal Yadav, and you are watching and learning coding with Kamal. Thank you so much for watching this.